Today, we are diving into a topic that might not get as much attention as some other health conditions, but is super important. Hypomagnesemia. Sounds complex, right? But don't worry, we are going to break it down in a simple and engaging way so you can grasp it easily and understand why it's such a big deal. What exactly hypomagnesemia is? Hypomagnesemia happens when the magnesium levels in your blood drop below the normal range, which is between 1.8 to 2.6 milliequivalent per liter. That's 0.74 to 1.07 millimole per liter for those using different units. Now, you might be thinking, why should I care about magnesium? Well, magnesium plays a crucial role in so many of your body's daily functions, like helping your muscles contract, keeping your bones healthy, and even ensuring your nerves sense signals properly. Causes of hypomagnesemia. Now let's talk about why someone might end up with low magnesium levels. There are a few key reasons: not getting enough magnesium, malnutrition, and starvation. When you don't get enough nutrients, your body can become low in essential minerals like magnesium, vomiting, or diarrhea. Both of these can lead to big losses of magnesium because your body is throwing out more than it's keeping. Malabsorption syndromes, conditions like celiac disease or Crohn's disease, prevent your body from absorbing enough magnesium. No matter how much you eat, losing too much magnesium, like through medications or chronic alcoholism, in medications like diuretics, certain meds can cause your body to excrete too much magnesium in your urine, and in chronic alcoholism, heavy drinking disrupts how your body absorbs and retains magnesium, and magnesium shifts due to hypoglycemia, insulin, and sepsis. In hyperglycemia, high blood sugar can make magnesium move from your bloodstream into your cells, reducing its levels in the blood. Insulin can push magnesium into cells too. Sepsis. Severe infections mess with magnesium metabolism, which can lower blood levels. How, how hypomagnesemia affects the body. Let's get into the symptoms and signs your body might show if your magnesium levels are too low. Cardiovascular effects: tachycardia, fast heart rate. Ever feel your heart racing? Low magnesium makes your heart muscles more excitable, causing them to beat faster. Your heart is working overtime because it is not getting the right signals. Hypertension, high blood pressure. Magnesium helps keeps your blood vessels relaxed. Without enough of it, your vessels might tighten up, leading to high blood pressure. Respiratory effects: shallow breathing. Magnesium is also vital for your muscles, including those that help you breathe. Without it, those muscles can weaken, leading to shallow or even labored breathing. In neuromuscular effects, hyperreflexia, twitches and paresthesias, positive troches, and Sostex signs, and titanian seizures. Hyperreflexia, reflexes going a bit crazy. Low magnesium makes your nerves and muscles more sensitive, so you might have exaggerated reflex reactions. Now, in twitches and paresthesias, you might notice some muscle twitches or feel a pins on needles sensation. This is because magnesium keeps your nerves calm, and without it, they become overactive. Positive process and Zolatex sign. These are fancy medical terms for signs of nerve irritability. For example, if your hand spasms When blood flow is cut off or your facial muscles twitch when touched, that could be a sign of low magnesium. Tetany and seizure. Severe magnesium deficiency can cause muscle cramp and even seizures due to overexcited brain cells, central nervous system effects, irritability, and confusion. If you find yourself more irritable or confused than usual, it could be because magnesium is essential for brain function. Without it, your brain struggles to keep things running smoothly. How do we find out? Laboratory findings. The most obvious sign of hypomagnesemia is a serum magnesium level below 1.8 milliequivalent per liter in ECG readings might show changes too, like tall T waves and depressed ST segments. This can indicate that your heart is struggling due to low magnesium. Taking action like taking action intervention and performing interventions. Now, what do we do if someone's magnesium is too low? Here's how we tackle it. Correct hypocalcemia too. Low magnesium often goes hand in hand with low calcium. So we need to correct both to keep the body in balance. Oral magnesium supplements. If you are not too sick, you might be given magnesium supplements to take by mouth. Just be careful. They can sometimes cause diarrhea, which might make things worse. And intravenous magnesium sulfate. For more serious cases, IV magnesium sulfate is often used. This gets magnesium into your system quickly. We will need to keep a close eye on you, though, to make sure your levels don't go too high. Seizure precautions. If magnesium levels are too low, there is a higher risk of seizures. So, we take special precautions and frequent monitoring. We will check your magnesium levels regularly to avoid swinging too far in other direction. Hypermagnesemia. Watch for diminished reflexes. If reflexes start to slow down, it might mean magnesium levels are getting too high. In dietary changes, we can also boost magnesium levels naturally by eating more leafy greens, nuts, seeds, whole grains, and legumes. These are rich sources of magnesium and can help keep levels stable over time.